Hi, everybody, and thanks for joining me, Colm Holland, on yet another amazing Alchemy Lab podcast session today. As you know, those of you that have been following, and if you haven't yet subscribed, please subscribe to the podcast because you may have missed out on some amazing people who've got incredible things to talk about. And today's guest is no exception whatsoever. Her name is Dr. Amy Robbins, and she is a clinical psychologist. She's also a wellness speaker. She's also a professional podcaster, not like me. And she has a podcast called Life, Death, and the Space in Between. And one of the things that Amy and I've actually spoken on Amy's podcast. So if you want to Google that and go and have a look, you can see what amazing conversation we had. We were so excited about what we discussed that we said we should do this again. So that's my primary reason for inviting Dr. Amy back again today. We are both fascinated and committed to the whole topic of personal transformation, of wellness and well-being and true joy, and finding true joy in life, which is all of our inheritance and should be something that we can all benefit from in one way or another. And so we're both committed to helping others in our own ways to find that and to share that with other people. So please join me to welcome Dr. Amy Robbins. Hi, Amy. How are you?
Hi, great. Thank you so much for having me. It's so nice to be back in conversation with you again.
Same here, absolutely. I've been really excited about picking up almost really where we left off. But this time, I want to give a lot more space. Obviously, last time it was me going on quite a bit about my book and what I've written and what I believe. But today I'd love to find out a lot more about you at a personal level, but also I'd love to find out what it is that you do as a practitioner, particularly as a clinical psychologist. You say, and actually, by the way, everybody, Amy's based in Chicago, USA. You say that you love talking about the space between life and death, which is, I find that fascinating. I don't think I've ever heard anybody really state that before. A space where you say we struggle to find most of our answers. You also say that if we're brave enough to become and stay conscious, which often includes truly facing our fears about death, we can begin to illuminate life. Fascinating topic. What exactly do you mean about the space between life and death?
Yeah, I mean, I think it's so multi-layered is this notion of the space between life and death, because I think we often race through that space. You know, we're not paying attention to our lives. We're not conscious. And both from a psychological and spiritual perspective, we think of being conscious or unconscious. You know, my training was in really sort of a more traditional Freudian type of therapy that really looks to reveal and uncover all of our unconscious beliefs and our unconscious wishes and fantasies, but also from the perspective of spirituality. And we think about mindfulness and consciousness. It's so important to be consciousness and to be present in our everyday lives. And I think often so much of our difficulty being present on some level comes from this fear of our mortality, of what's going to happen to us when we die. And so it's my belief that when we really face that, and when we think about it, not just from a beginning and an end as the space between life and death, but I also think about it as the space between what happens when we die and perhaps when we even come back again. So it's got so many levels and so many layers to really dig into. And so my journey in thinking about the space between doesn't end at death. It really encourages people to go beyond their thinking about a permanent death in the sense that of the physical body dying, but to really think about what happens to our soul and where does our soul go. And even using that knowledge can inform us how to live more presently, purposefully, consciously now.
Okay, so let's clear up a few things just for the benefit of everybody, we are not talking about subscribing to a particular religious belief.
Absolutely not.
Absolutely
No.
not. Okay, so let's get that out of the way. But obviously, a lot of people's religious beliefs does really influence their view on this. So, do you notice when people come to you to talk about? I guess they're not coming to you initially to talk about, oh, I'm really frightened of dying. I'm guessing that that's possibly the least thing on their mind. They're probably more coming with, I don't know why I always feel so depressed, or I'm really struggling with this personal relationship, or I feel I just can't move forward in my life to be, happy in some way. So, just what's the progress from those symptoms? I hate using the word symptoms, but for the want of a better word, from presenting those symptoms in a clinical environment to you then ending up talking about life and death and the space in between. How does that normally work?
Well, I think that it's not necessarily always present, but oftentimes there's some underlying loss or grief that's been,
Okay.
I don't want to say sort of complicated grief, meaning that it hasn't, people haven't had the opportunity to really work through the grief. Not that you ever get over a loss, but you can move through it. And so oftentimes that's when I'll start exploring. And again, as a therapist, I don't push this belief system on anybody. I never push this belief system on anybody as a human or as a therapist. I think that I just want to open up the conversation around it, to understand where people are coming from. Because when you start to ask people, oh, have you ever had any spiritual experiences? I don't necessarily mean, which we'll get into, my own spiritual experience and how that was, but have you ever had a spiritually transformative experience? Have you ever felt like there was something guiding you bigger than yourself? People start to answer yes to those questions. And then it gives the opportunity to really open up a discussion as to what else might be out there, how we might understand these pieces of our lives, and how we can then use them to help us and inform us and guide us. So sometimes we really, in therapy, may or may not address this. There's a very famous therapist, Irving Yalom, who actually says, if you never talk about death in therapy, then you've never done a real treatment, which is, I think, a really interesting way of thinking about it, because there is this existential piece of meaning making that anybody who comes to therapy is typically thinking about, which is, what is my meaning? What is my purpose? What does it mean to be here? What does it mean to be in relation to others? That often comes up at some point in the course of treatment.
Okay. I'm reminded, actually, from what you just said in that progress, how Carl Jung, Professor Carl Jung, colleague of Freud, of course, he had one particular patient who was really resisting that spiritual aspect, the fact that there was anything other than her own logic, and that if you can't understand stuff by logic, then there's nothing else out there, and that there isn't another dimension to life. But she just happened to mention to him. But strangely enough, she says, I had this dream the other night where I had this beetle, this sort of carob beetle appear in the dream, and he looks behind her, and there at the window there's this scratching on the window, and he goes over to the window during the therapy session and opens the window, and there's a carob beetle, and he presents the beetle and says, oh, is this the beetle from your dream? And then that opened just a door in her consciousness, opened up and said, oh, okay, so the dream and that experience that I just had, those are connected things, and there's no logic in that. So do you find, do people present much in the way of wanting to understand the synchronicity, the events that are going on in their lives day to day? And are you able to use that material?
Yes and no. I mean, I think that sometimes, this has been a real shift for me, and my podcast was sort of my coming out party in this sense, where I really started to put out there how much my spirituality has shaped who I am. And so inevitably that has kind of bled into my work. But again, it's not something that if someone doesn't subscribe to, I encourage them. I do encourage, but I don't push it on people. It's more really how I talk about it sort of in my everyday life and what I hope to move towards doing that is going to be more focused on kind of, let's look at those synchronicities. Let's look at how the universe, God, whatever you believe, source, I mean, people use all kinds of names for this, help to put things in your path that, you know, you had this experience, right, with
Yep.
the alchemist.
Yes.
And how we respond to those things. And that, I think, is what becoming conscious really means, is, do we notice when these synchronicities are there for us? How do we then use those to help inform and make the decisions that we're making? Because they're always there for us, right? I mean, you and I talked about this when I interviewed you. But sometimes because we're so unconscious in our lives, we're going through the day-to-day. I know it was teasing you, we were talking before I got on how I had to get my groceries in the freezer before we had this this interview, that you lose when you aren't present. You lose the ability to see the synchronicities, which then prevents you from being able to kind of cooperate with the universe in that way.
Okay. Now we are in a mythical alchemy lab in this particular podcast. So over in the distance, you'll be able to hear in the background, I got various, I'm just stirring up different potions and things. One of the things that we always talk about is our own personal transformational journey, because the alchemist is somebody who turns lead into gold, which is a metaphor for turning, the base, probably the things of our lives that we least respect, into our best treasure. So I'm going to have to ask you, Amy, I'm terribly sorry about this, but can you fill us in a bit about your own journey, especially coming from such a academic, clinical psychologist background?
Of course. So when I was 18 years old, I lost my aunt, my mom's sister. We were very, very close. My family's very, very close. So she was like a mother to me. She passed away from juvenile onset diabetes. So she was old. She wasn't old. She was 48. I don't want to say she was old. She was very young, but she was not a child when this happened.
Yeah.
She was waiting for an organ transplant. And while she was waiting, they needed to put her through a series of tests because they didn't want to give her organs if her body couldn't sustain it, because they weren't sure what the diabetes had done to her body. During that process, they realized that her heart was really weak and she had had numerous heart attacks she didn't even know about. So when they went in to repair her heart to make sure it was strong enough for the organ transplants, she died on the table. I was a freshman in college. I was on my own for the first time. I remember getting the call, and this was really the first death. I had had a couple of friends who had passed away, but this was someone really close to me. They were sort of people I went to school with, and they were young, so it was tragic. But this really shook me to my core. And in so many ways, as a result of her death, I found myself riddled with more anxiety that was manifesting in panic attacks and just this really intense fear about if what happened to her was going to happen to me. I had a lot of identification with her, that I'm not ill, I don't have diabetes or anything, but I just identified with her in a lot of ways. Fast forward to grad school, when I had my first, what I now know was a visit from her. At the time, I thought it was a dream. She came to me, she shared with me that she was going to be at the wedding of my cousin, her son, that was coming up shortly. It was very real. She told me to tell my mom that she doesn't need to cry. that just to let her know that she would be there. So I woke up that next morning. I called my mom. I said, I had this crazy dream last night. You were standing at your kitchen sink crying, and Linda, which was my mom's sister, came to me and she said, you don't need to cry. She will be at the wedding. And my mom started crying again and said, I was standing at my kitchen sink last night, crying, talking to her, saying, I can't believe you're not going to be at this wedding. And so that was sort of the opening up for me. Okay. And I had a wonderful professor at the time, and I went to her and I told her this. And there were more details to this visit as well that were confirmed by my uncle, because she shared things with me about him as well. And my professor, who was also very grounded in science and theory, said, you know, I think this was a visit. I don't think this was a dream. And I think you need to open yourself up and pursue kind of your ability to connect in this way. Wow. And so that's how the ball started rolling.
So did that mean you went and started researching and absorbing yourself? When you talk about opening up, did that result in wanting to discover more about other people's experiences? How did that roll out?
I think it really rolled out in terms of me wanting to develop my own ability to connect to something greater. There was so much comfort in experiencing her as still very alive. She was very you could tell she was healed. She didn't look weak. She always looked very weak in her life, and she looked very strong and vibrant. And she said, my body is healed. And I actually realized only recently that I had an earlier experience where she came to me, but at the time really thought it was a dream. That was shortly after she had passed. And I can still visualize it as clearly today as it happened then, which is, as I've learned, really shows that it was a visit and not a dream, because our dreams typically are harder to remember and hold on to in that way. Mm-hmm. But I started exploring mediumship and really opening myself up to communicating with people's loved ones who had passed. And I started experiencing things in sessions that were a little stronger and a little bit more profound, perhaps, from people's loved ones who had also passed away. And then I worked with a woman for 2 years who was a medium, really training myself, excuse me, to open myself up. And then did a internship, and I use quotes because I called it that, and just saw people who were interested in having readings and practiced. And then I sort of realized it wasn't the path I wanted to go down. So after all that, figured, you know what, this really isn't it for me.
But I'm assuming, and I can understand why that wouldn't be for you, and I think you have an enormous amount to offer just as a clinical psychologist anyway. But how has it informed other outcomes as a result of you being open? What other outcomes are you able to bring when you're working with people? What other, do you find you have knowledge that they're not expressing, that you have an understanding that maybe they can't see beyond it being somebody visiting beyond the grave?
Right. It's now become so difficult to separate out what is experience versus what is intuition at this point. Okay. I've been doing this work for 15 years now. Okay. I will sometimes have sort of flashes of things where I get a vision of something that feels like it's just not maybe relevant in this lifetime, sort of maybe a past life experience. I never say, I think you had a past life in blah, blah, blah. I always sort of couch it in, do you have the experience of feeling this way historically? And when do you remember that experience beginning? Okay. So I try to use it in that way as a way to open up a conversation, rather than saying, well, I think you had a past life where you were in ancient Egypt and, you were the pharaoh or something along those lines. But really trying to just slowly open people up. Or I'll really have a sense that whatever they're experiencing did not originate in this lifetime. And so I'll try to explore that with them again, not in, I think this was a past life, but really kind of trying to understand more holistically how these pieces fit together.
So on a personal level, and thinking about your own relationship with another dimension to life, from the time on that you first encountered your aunt after she passed, what changes in your own day-to-day life and experience have you discovered? Has this made a serious impact on your own well-being, your own sense of worth, etc., etc.?
I think it's been probably the most profound experience of my life in that I am no longer anxious. It's very, very rare that I feel anxiety. And if I do, it is so fleeting, and I'm able to recognize it because I can bring myself right back to the present moment and know that there is something larger out there. And I think that there's just a sense of trusting and knowing that allows whatever happens to sort of unfold in time. So that does not mean I'm a passive person. I'm by no means a passive person. I'm very, very engaged in life. But I trust that even when things are difficult or feel like a struggle, that ultimately it's for my higher good and it will work out for me. And when I say higher good, I really mean my soul. Yeah, I think when we think about being in alignment with our soul, things are just easier. Life is just easier. There's not that battle, that struggle, that constant kind of tension and the push-pull and the complication of life. Whereas it seems like, some people talk about it as being in a flow state. It just seems that things fall into place. And I think, again, because you're paying attention to the synchronicities, it's easier to see how things are falling into place. And you, when things are out of place, for me, what I attribute that to is just my soul needing to learn and grow. And so how can I use these experiences to help my soul learn and grow in that way, rather than to resist and fight against it? Because I think when we do that, one, we're not in alignment with our soul. We're usually in an ego state. And then life's just so much harder than it needs to be.
Okay. Let's talk about love for a moment.
Ooh.
So you've seen a lot of people on the couch, as it were, in your therapy sessions, and I'm guessing that one of the topics you nearly always get around to is their sense of being loved, their understanding of love, the nature of love in their life. Do you want to just share a bit from your own perspective about your sense of being loved and how vital that is to existence?
I think about it often as it comes up as, am I worthy of love? That's
Okay.
usually the question that comes up. It's about worthiness and love. And I think that when we feel like we are not worthy of love, we feel like we are not worthy of anything in this life. And so when we can, and that comes really often from a sense of our own childhood and upbringing and how we're raised and how we are loved by our parents. And if you're loved unconditionally and you feel that wholeheartedly, that's a huge leg up in this world, right? And then when I've experienced speaking with people on my podcast who have had near-death experiences where they report the thing that usually is the most transformative for them is this feeling of unconditional love.
Amazing, isn't it?
Yeah, it's so fascinating, right? And so when we think of that and we think about giving love and we think about what are there often conditions in which I'm giving love? Because usually with most people, particularly if you didn't have the experience of being loved unconditionally, you were going to have conditions in terms of being
Sure.
loved and loving
Yes.
others.
Yeah.
And so all that does is create this cycle of unworthiness. And then when you have this, when we think about how this all kind of weaves and ties together, and it's not simple, but when we think about being unworthy in love, how that then shows up in every single other aspect of your life. And then we think about what you're attracting, and you can start to think about the law of attraction and how you are manifesting that unworthiness in other areas of your life and attracting that you don't deserve. Usually it's a good relationship or abundance or, the
Just
list
well-being,
usually,
just well-being
yeah,
in general. Yeah.
overall well-being, joy, contentment, all of those things,
Yeah.
because I really do think they come back to this sense of, am I loved or am I not? Am I lovable or am I unlovable?
Well, because of the podcast I did with you when you were interviewing me, that one of the things that I talk about quite a bit in my book, The Secret of the Alchemist, is how through working from a very young age of 18, right through to now, all these years later, well, yeah, I'm just trying to think, yeah, 50 years later, it's been a long journey. But for me, the essence of acceptance of myself, of my unworthiness, and I won't go into the detail of that now, but because I spell it out quite clearly in my book, that how when I opened myself to love, it was more, for me, it was more than just a logical process of thinking, well, I must be okay because of this, or I must be okay for that. What I found I had to do was, and we talked about the unconscious earlier, but what I found I had to do was to sort of clear all of my preconceptions about myself in a way, and think of love as not so much a being, but a power, an actual force, an entity. Like you said earlier, lots of people call it different things. I try not to give it names. I try to call it love, because to avoid confusion of what this thing is or what this force is in my life. And what I've discovered, and I'm sure this is the experience of lots of people that come to you for help, is that when you allow that love to embrace those inner parts that we ourselves despise, those parts of ourselves that we previously regarded as weak, or our failings, or the things that let us down, or the things that trigger and make us want to put conditions on it. When we let love embrace those things, that's when it actually becomes like a magic power, a transformative power, and it actually becomes our greatest treasure. And the moment that we actually accept that our weakness is probably one of our most valuable possessions, that is like stepping, to like C.S. Lewis, it's like going through the wardrobe into Narnia. There's another world on the other side of that wardrobe. Okay, it's not all straightforward, and there's going to be battles to be fought and so on. But the difference is that we've now got this power on our side. And in Paulo Coelho, in his book, in The Alchemist, the original, he says that when we make that choice to let the universe, to allow love to transform us, all the power of the universe conspires to make that happen. And so I know you don't push the spiritual on your clients when you're working with them, but you must, I'm guessing that you must see transformational things happening as people open up, as they begin to accept the fact that they may not love themselves unconditionally, but love accepts them unconditionally. That's a whole, new dimension.
And that I accept them that they have the experience oftentimes in therapy of feeling that love, hopefully, I hope, from me, because there is a process as a therapist of literally falling in love with your patients, and not in a erotic love, in a very for me, I can only compare it to like a maternal love, having children, or just a love of the human experience and the human struggle and the respect for that.
Yes.
And so when people often say, well, what's your technique, or, what type of therapy do you practice? I really practice the therapy of love. I mean, it sounds kind of hokey to say it, and I've never even thought of it in the way that I'm talking to you about it now. But when I've seen people transform, a huge part of the transformation is the fact that I believe in them and I care so deeply for them and for their well-being, that they begin to internalize that and see that in themselves, even if those words are never, ever, ever spoken in our work together, right? I've never said I love you to a patient, but they know and feel that love, because when you feel it, you can't unfeel it. You can't deny that it's there.
Well, we can feel it now, Amy. So even though we've got lots of technology between us and different screens and lots of thousands of miles of cable, it's obvious from your whole demeanor and the very core of your heart that that's how you feel. So to be in a room with you and working with you, I can see how that. There was a guy called Thomas Merton who was a contemplative monk. He was quite a groundbreaking guy, and wrote a lot about his understanding of Buddhism and how that influenced his own Christian prayer as a Trappist monk. And one of the things that happened to him, there's actually a monument on a corner of a street somewhere. It's in my book. I talk about it. I won't mention it where it is now, but there is a street somewhere, and it says, on this spot, on this day, at this time, Thomas Merton, the author, the famous author, had a transformative experience. Not that he felt transformed, but he saw other people, ordinary people, just walking down the street as transformed beings. That they were an expression of God in his mind, that they were spiritual beings, but they were also the most treasured and the most valuable thing that there is in the universe. So rather than walking down the street and just thinking, oh, the street's a bit crowded today, oh, I hope that nobody's going to get too near me, or, oh gosh, they're not behaving very sensibly, and all the judgments that we so often make when we're out in public. He abandoned that, and he just had this incredible inspiration, and that's something that I've been trying to practice, actually, especially with COVID around, is not to project our fear, and particularly with COVID, our fear of death, onto the behavior of others. And if we can do that, then I think so.
Well, and I think,
go ahead. No,
I was just going to say, I think to your point, like, this is a practice, right? Like I think that people sometimes get caught up in this belief that when you have these spiritual experiences, these spiritual awakenings, these, whatever you want to call them, spiritually transformative experiences, that then you're walking around like all the time in this blissful, content, happy, wonderful state. And that's just not true. I have moments where I get frustrated with my husband and frustrated with my kids, and, I'm freaking out a little bit about this whole homeschooling, remote learning, whatever it's not homeschooling. I've been schooled in, it's not homeschooling, it's remote learning. but that there become more moments of your life that are filled with that presence, that love, that overwhelming sense of alignment with your soul, however we're going to define it. And those become more of the moments in your life. And then you begin to really have a beautiful life, because you start to piece these moments of love and joy and contentment together. It's not that it's always like that. It's that we have more moments of that than we do the other.
You are a beautiful person, Amy. Thank you so much for sharing with us today. Did you have, we're almost out of time.
Bummer, this was so fun.
I know.
I like being on this side of the mic.
Yes. The pressure's all on me today. But let's, do you want to ease us out with any thoughts or a passage from a book? What are you reading at the moment? Is there anything you want to share with us?
Well, so I was going to share, I always have this book, The Untethered Soul, on my nightstand. And in it, one of the things he says in this chapter on contemplating death is, the question is, are you going to wait until that last moment to let death be your teacher? So that was what I wanted to bring up. But then as we were talking, I remembered a quote that I'm going to probably butcher because I'm not looking directly at it. But I think it was Einstein who said, the main question that you have to ask yourself is the universe a friendly or hostile place? Because that question then guides so much of how you see the world. And I think that quote, just in what we were talking about today, just seemed relevant. So I'll kind of leave you with those two pieces of things.
Both wonderfully inspirational and something we definitely could benefit from by, going on from the rest of our day today after listening to you. Thank you so much, Amy, for spending the time in between grocery shopping and kids schooling. Wonderful that you have this ordinary life, but you're living it in such an extraordinary way, which is truly inspiring. So thank you so much for joining me today. I'm sure this isn't going to be our last conversation. I'm sure one of us at least will find an excuse to jump on another podcast in the not too distant future, I hope.
Definitely. Thank you so much.
Blessings. Thank you, Amy.
Thank you.